So my name is Marcia Nickow. I'm a clinical psychologist and group psychotherapist specializing in addictions and trauma. And so I have my own private practice in downtown Chicago. And here I'm a supervising psychologist and running an IOP group and also outpatient groups and seeing some individuals as well. And my philosophy, I've been in the field for almost 30 years, and I love working with addiction and recovery. And I like my model, and SunCloud's model is to understand all addictions, understand addiction as a disease that has many different manifestations, and that is a way that many people medicate underlying trauma, and they don't always know that they have trauma, like a lot of people don't. And the definition of trauma is very broad. It includes lack of nurturance that people have had in their growing up environments. Of course, it includes sexual, emotional, and physical abuse, but also the neglect that happens and the abuse in addicted family systems, and also being raised by caregivers who are, for whatever reason, unavailable, like in process addictions too, like gamblers, work addiction, eating disorders, or depression and mental health issues that keep them not fully engaged, with their kids as the kids are growing up. And so also, grief and loss issues that happen, and a lot of adults and young people are impacted also by intergenerational trauma, like things that have happened in the family system and are being passed down, often unconsciously, to the next generation. So basically what I do is very thorough assessments of people as I'm meeting with them, and then work with them individually and mainly in groups, to work through attachment issues and connect with other people and have new hope about loving themselves, because many people who have addiction issues and trauma have a lot of self-loathing and a lot to get through in order to connect in the world and have intimate relationships and success in the workplace and life. What I have found over the years, it used to be that addictions treatment programs, they're very group-based. That has always been the case, and that has been a way that treatment centers could prepare people to continue their recovery in 12-step programs, which is group-oriented but very different than a therapy group, because it's a self-help group and there isn't crosstalk during the meeting. In therapy groups, what happens is that people have a safe environment that has therapeutic support in order to confront their defenses, because they put up psychological defenses with other people that blocks out true intimacy. It might be codependent relationships, like rescuing someone else. It might be acting really tough, and so it intimidates others, wearing the various masks that they've needed to survive difficult childhoods, for people that have had trauma, or the challenges of growing up without their needs being adequately met, to put it, mildly, because many people it's much more severe. But what happens in the group is that the therapist and other members, everybody's a therapeutic agent. And I believe that the community, that at the community level, the community is a therapeutic agent, and so the groups are microcosms of the community out there. And within there, we, myself as the leader and other members, can confront the defenses that people put up that blocks out a true relationship. Addiction is really a disorder of attachment, and the attachments haven't developed early in life for very good reasons, it wasn't safe, for a million different reasons. And so here now, in a whole new environment where the family can be reenacted, because the family is our first group, really. And so a lot of times people come into a group and they end up in the same role that they are in their family. And myself as a therapist could confront that as it's unfolding, and even kind of freeze for the moment for us to understand what is getting reenacted that looks like a conflict between members of the group, but may very well be something that goes way back, and it shows us where the work is, of where the wounds were that need the healing for them to move on. And so what happens in groups is that long-term groups is my model. And so people are going through like ongoing recovery and building and growing and strengthening their relationships. And as that begins to work in the group, and they feel loved and accepted by others, and that they understand what mutual relationships are like, it becomes possible for them to take what they've learned there, and in this microcosm, like a laboratory for learning out there, and bring it out there. And so that happens very organically, that as people build, build themselves and their self-esteem, that they feel better about who they are, and so their relationships everywhere improve. In the ideal sense, we all have our human struggles, and everybody's imperfect, and there's always something to work on, but I've seen people just change so much from being extremely in isolated worlds, engaging in self-destructive behaviors, to being very active members of the community, like in developing in careers and in love relationships and having children when they never thought they would. I love them, I love to see people grow, and change and connect with their gifts, which is another thing. A lot of people have artistic gifts that were never developed, that are really key to their identity and who they are. A lot of people have been, isolated for very many reasons, depending just on the community or their parents or cultural, political beliefs, in a way for people to discover what they want, not only what someone wanted for them, like their own voice. So I met Dr. Kim Dennis at a conference, and we were both doing a lot of experiential work at this conference around our own roles in groups and how we take up authority and leadership. And I was really impressed with her. We talked quite a bit and had a lot of similarities in the way that we understood addiction and underlying trauma, and the love that we have for the patients, and how we want to treat them and help them grow and model recovery for them as we grow ourselves. And so she had been just named medical director at Timberline Knolls. This was about a year after the conference that I ran into her on the street. And she was very excited about her work there. And she said, why don't you come out? And I thought, oh, it's too far. Timberline, it's in Lamont, and no, I'm in Chicago. But then she said she looked so happy, so I went out to see her, and she was, and I thought it was such a beautiful way to be able to provide a lot of help to people. There was lots of resources out there. So I was very impressed with her, very much enjoyed working with her. I was overseeing the therapists, and she was overseeing the whole program as the medical director. And we worked on a lot of ideas together, tried a lot of things, intervened in a lot of ways. I appreciated her flexibility, especially people with trauma sometimes will not participate in the entire program, especially 12-step meetings. And I know that she allowed me to be really flexible and creative in drawing people in ways that they were able to engage, and then build on the steps that they were able to take. So I appreciated the approach that she had, that we'll meet you where you're at and build from there on next steps. We both loved, the people a lot, and a lot of times that's what they really need. I think that's part of what they need, is to know that you really care. So I think she's rare and very smart, lots of integrity and depth. Any successful addictions treatment program has to be has a very deep understanding of trauma, trauma at the root of addiction, whereas lots of programs are very medical model, like we identify this as a disease, so now you have this disease, and just like a person with diabetes needs to take these steps, you need to take these steps. Like it's been a very disease model program, which I believe in the disease model. There's a strong genetic component to addiction, but I think the other part is really important too. And when I first started working in the field, I felt like I had to address trauma undercover, because like supervisors were always saying, oh, don't open up those wounds, we won't know what to do with those. And part of addiction treatment is, what is your story? So, and I had been a journalist. I was a journalist for 12 years. And so I just got their whole story right away. And so I would know exactly what happened to them, which was horrific things, because that happens a lot, and at that time I was on the West Side. And then they would be like, wait, we don't go there. We're not supposed to know that, And so we're not supposed to dig into that because we don't know quite how to handle it. That was the approach then. And now trauma and addictions, the conferences of addictions always have a trauma focus as part of it now. It's just very different day. And so I think we've been leaders with that approach.